So now we have part 4, and in this part we are going to compare new decision therapy with other methods which are used in order to release trauma. And we're also going to discuss maybe some topics which relates to clinical testing of new decision therapy. Now, one question which we can discuss here, if we try to compare new decision therapy with other techniques, for example, let's start with conventional psychotherapy, what would be the differences in application of the technique, like maybe with other topics related to like speed of application and success rate?
Well, first of all, I am not a psychotherapist, so that isn't a technique that I'm personally trained in. Although new decision therapy has wonderful therapeutic benefits, we don't refer to it specifically as a therapy in that sense. It's very streamlined, and we do spend far less time talking about the details of what a person has gone through, and are much more focused on just simply identifying the situation, finding a crystallized understanding of what went on, and then helping the person through the other side of all those emotions. So it is an accelerated process. Not everybody is going to be ready for it, and that's where psychotherapy has its part and its role. In fact, new decision therapy, quite frankly, would be a wonderful, wonderful adjunct for psychotherapists to have available to them when they're dealing with a client who's just going round and round and round the same loop of behavior and misunderstanding, and they're just so stuck. New decision therapy can oftentimes be that perfect tool that will help them get out of that stuck state so that they can be more productive in the psychotherapeutic process.
And there are specific techniques such as, for example, clearing of denial, which would be also beneficial, of course, for psychotherapists to have, because if denial is not cleared, the information, according to new decision therapy teaching, can be not correct, because the body does not have, the muscular kinesiology checking that we do does not allow us to have true information. Yeah, it would be correct to say.
Well, the client is just simply not going to entertain certain subjects. It's not even going to come up in the conversation.
Mm-hmm.
And so, for instance, like I have every respect for psychotherapy and the part that it plays. And at the same time, I have, met people who've come to me to experience the new decision therapy process and have commented that in the first session that they've shared something first of all, they've never told anybody, because there's this thing that happens when you open up the energy pathways and clear the 3 layers of denial. Suddenly, things are being revealed for the first time. They may never have told anyone, even their, 10-year trusted psychotherapist. And just with these energy pathways open, something happens where finally what needs to be said is said. Yeah? And, I would just, I believe that the process itself could be a beautiful adjunct for many other forms of traumatic, dealing with trauma that are out there already.
I found with my students, actually, I think had probably 3 students who had also years of psychotherapeutic counseling, and they told me similar stories that the psychotherapist was able to identify the trauma when it happened, and the client just became, of course, emotional with tears because the event is traumatic. That's makes total sense. But what I found with these students was also kind of the whole new decision therapy was much easier to proceed with, because we already know what was the event, who was the person who created the trauma. So kind of it's speed up the process of new decision therapy. But
that's where they're working in conjunction with each other, and the fact that has happened has created a readiness in their system, and maybe they wouldn't have been ready before they had that information. Sometimes the information can come right away in the NDT process, and this is where it's just, you can have people coming in the doorway of new decision therapy having tried many other different things. I was one of those people. You can have somebody coming in and NDT, new decision therapy, is the first thing that they've explored, and I've seen all sorts of interesting unfoldings from there. For instance, someone who just wasn't open to their spiritual expression, maybe even coming from a kind of atheist point of view, suddenly, because the heart has been opened and they're understanding themselves and others from a more compassionate viewpoint, they become more curious. They become more curious than they were curious about life, curious about their own spirituality, etc. So I've seen that open up and it doesn't mean that it has to or that it's going to. Just I've seen it play out that way sometimes. Many times I've seen people who've been, going through a very bumpy ride with their relationships and so on, that things smooth out. And I don't know if this is the right time and place to bring this up. Just I was sharing with you earlier a couple of examples of people who thought that they needed their partners to change. Mm-hmm. Yes? Do you want me to talk about that now?
Yes, that would be, might be, we can.
Okay.
Like you had examples of, I think, females who thought that their current relationships have problems with their husbands, yeah?
Yeah.
Whereas the real problem was totally in a different, similar area.
Well, they came, so one particular person who came in and just initially wanted couples therapy, and I said, well, he really wasn't open to it. I said, but come, it really only takes one, and you never know, right? Like I had more of an optimism about how it was going to shift and change just because of my experiences and of having seen it happen before. So she took that leap of faith, and lo and behold, she was very surprised that even though she had come into the whole process believing that this and this and this and this had to change about her husband, and could she stay in this relationship if things didn't change, and by the time we were finished, she realized, oh, he doesn't have to change anything about himself, because a lot of the stuff that was in her mind problematic with him was projected material from things from her past, and once those things were cleared up, she was seeing him in a more clear light and understanding that he wasn't the true source of her happiness, and that in a way that all those demands that she had of him so that she could feel happy in the relationship were completely unnecessary. Yeah? And in another case, someone who was really questioning whether or not to leave her relationship had already done some other new decision therapy processes, but was just hitting up against a wall in a crisis, came back in for what I refer to as a tune-up. And so we did the tune-up, and she called me back a few days later. She said, I can't believe this, that I was so ready to leave my husband. I've just completely fallen back in love with him again.